I'm a college student at Mary Baldwin, and I'm a mother. Her name is Kennedy. She's 3. I was in a car accident. I hit a tractor trailer. I was in a coma for 2 weeks at UVA. My brain swelled up.
She was going to pick up her daughter and traveling in some bad weather, and a tractor and trailer and her collided, and she suffered a head injury. They took her to UVA and immediately put her in a trauma unit, and they put in a device that would measure her brain swelling, and they put her in a coma. She was in a coma for over 12 days. She didn't respond. They told us after 72 hours that if they didn't need to go in and remove part of her skull, that she was through the rough part. And so 72nd hour, we were like, yes. But then the 76th hour, the measuring device that tells you if her brain swelling started going over 30, and they couldn't get it to come back down. So then they gave her like a paralytic medicine, which put her in even deeper a coma. Then we were told, this is the best you're probably gonna get. And one of the nurses there noticed that I was staying in a corner crying, and he came and talked to me and said, what's going on? So I told him what I was told. And he went and got neurology, and they came and they said, no, we're not giving up on your daughter. On the 7th day, I was sitting there, and I looked and I said, well, she looks like she has her eyes open. So it was wonderful to see her eyes open. From that point, it was, bam, bam, bam. She just progressed and progressed and progressed. They got to a point where they said, this is the most we can do, and she needs to go to, they said, an acute type nursing home. And I said, well, no, this is not acceptable, because I want more, and I know I can have more. So one of the therapists says, yes, you can. And she recommended Parham Doctors Hospital, their rehabilitation center. And I did some research myself and read some reviews, and I said, yes, this is where I want her to go.
When I met Terra, she was NPO, meaning she couldn't take anything by mouth with a feeding tube. She also had a tracheostomy, which was open. So the first thing we did was placed a speaking valve on it, and Terra, within the first minute of having the speaking valve on, was able to say, I love you, to her mom, and she was able to say mom, so that brought tears to everyone's eyes.
Morgan, her occupational therapist, who then started working with her, just hand exercises, just talking to her. Kristen and Morgan, and then Sarah, who's her physical therapist, came in, and it was just a progress. It's like every day I thought I could see a little more. Before I knew it, I walk in the room and she's sitting up between the two of them. And before I knew it, she's sitting up by herself, and she's rolling over, and she's talking a blue streak. And the next thing I know, they have her on her feet.
We had her up and walking first in our vector system, and then, progressing to a walker. She's just blossomed ever since then. She's climbing full flights of stairs now. She's getting in and out of the bed by herself, on and off the toilet by herself. We're walking inside, outside.
Learning to walk again has been really difficult. It's getting better. I can bathe pretty much by myself now. Before I needed, a bunch of people there. So that's nice that I'm a little bit more independent.
In terms of eating, we quickly progressed Terra to eating. She was able to take in regular foods, regular drinks within about 2 weeks of coming to Parham, which was exciting. And now leaving, she no longer has her peg tube, and she no longer has her tracheostomy tube.
Never once has anyone come in Terra's room that didn't talk to her as if she was actually able to communicate and and explain what they were doing, talk about the medicines. Every one of them are friends to Terra. I mean, she even convinced one to dye her hair for her. And they banter back and forth just like friends.
I feel like the staff here has been really caring and on top of things with me, so I really appreciate that.
Dr. G, I think, is probably the most awesome doctor either one of us have ever met. I mean, that man is right there for you. He even wants to talk to her school advisor to help her continue her education. That's over and beyond.
I'd like to finish college and to be a teacher and teach.
I fully anticipate she will be able to go to school and become a history teacher, which is one of her really big goals, and will be able to resume a normal life.
In my opinion, these therapists invest a lot of themselves in their patients. It's not just a job, it's just not, at the end of the week a paycheck. It's they truly care that you succeed and that you continue on with a fulfilled life.
I have worked with a lot of patients with brain injury, and I have not seen anyone improve as quickly or dramatically as Terra has. She has gone from essentially nonverbal, not eating, not really doing much but laying in the bed, to up and walking and talking about the future and talking about things that she wants to accomplish.
It's hard, but it's worth it.
It's a wonderful facility, wonderful. And she's our miracle.